the real crux of this is that Huntington's is a complex disorder. So it involves deficits in a number of different modes. So patients develop not just movement abnormalities, but also cognitive deficits, a quite complex array of psychiatric deficits. They, as the disease progresses, they'll need input from a whole range of specialists, including movement disorder specialists, psychiatrists, psychologists. There are a lot of psychological issues connected with Huntington's disease, a lot of social issues, input from OT. There are some complexities of the disease that, we might not initially sort of connect with Huntington's. So things like dental decay. So one of the problems in Huntington's is as the disease progresses, people become a little bit more apathetic. They develop problems in terms of voluntary movement. What sound like quite simple activities of daily living, such as maintaining dental hygiene, can become really quite difficult, combined with the apathy, so that these individuals are less motivated to maintain dental hygiene, can lead to high levels of caries and tooth loss. And so I think, it's the complexity that really requires a multidisciplinary approach. There are a lot of multidisciplinary clinics around the world where, and I think there is a feeling in the field that this is the best way to look after patients with Huntington's. Many of those clinics differ from location to location in the precise makeup of the healthcare professionals in that clinic. So obviously it's quite dictated by what's available in terms of local resources. And there are gaps in terms of geography as well. So even within one country, even within the UK where I work, there are some areas of the country that are less well served by multidisciplinary clinics than others. But I think it's fairly clear that a multidisciplinary approach to the disease is helpful. And I think that's unlikely, in my view, to change, and may even get slightly more complex as we progress. And hopefully in the future, obviously we don't know when, but hopefully in the future we will have some meaningful treatments for Huntington's disease, and hopefully some disease modifying treatments. I think it's highly likely that will nevertheless require that we still have multidisciplinary care.